Hi, this is Yuka. Recently, I created a website called MedGuide Japan. It's for foreigners who want to live in Japan and people who are already live in Japan and travelers visiting Japan. The website explains what to do if you get sick or injured while you're in Japan. So please check the description for more details. And at the bottom of the website, I made a section called Explanation and the Columns. In that section, I talk about differences between Japanese hospitals and the hospitals in other countries, including medical culture and how people think about a treatment. So today, I want to talk about one topic from that section: how people think about painkillers. Um, I'm currently working as a nurse in Canada. After actually working here, I've noticed that there are many things that I feel very different from what I consider normal in Japan, and not only treatments, but also the way people think about nursing and the patient's care. A lot of things surprise me, but at the same time, I found them really interesting. So today I want to talk about one of those differences. The way painkillers are used in Canada feels completely different from Japan. First, in Japanese hospitals, the painkillers commonly used are usually the it calls caronaru and loxonin. On the other hand, in Canada, Caronaru is basically Tylenol, and here Tylenol and opioids such as morphine are used quite often. Morphine or hydromorphine are used quite often. I work on an acute care unit for older adults, and I often see Tylenol and an opioid called hydromorphine prescribed. By the way, the opioid image shown here is an injection, but in reality, opioids are also commonly given as an oral medication. If the patient can take medication by mouth, oral opioids are often used. In Japan, opioids have a very strong image of being narcotics, scary, or dangerous. They are not commonly prescribed in regular hospital settings. Many people probably think they are only used right after surgery, especially on the first day or for patients at the end of life. So first, I want to briefly explain how each medication works, why opioids tend to be feared in Japan, and what we should actually think about a dependence or addiction. Then I'll talk about the difference between Japan and Canada. Let's start with Tylenol. In Japan, this is called caronaru. To put it simply, Tylenol makes the feeling of pain a little weaker. Look at the top of the column. As shown in the table, I'm going to compare pain to a fire. Tylenol is like turning down the volume of a fire alarm. It doesn't really put out the fire itself. Instead, it makes the pain signal feels less intense. So tolerance is relatively less likely to develop. I don't think many people imagine becoming addicted to Tylenol. Of course, any medication can cause problems if it's used a long time or used incorrectly. But the overall, Tylenol is generally seen as a relatively safe medication. Next is the second type, NSAIDs. In Japan, one common NSAID medication is sold under the name Loxonin. Using the fire example, NSAIDs are more like putting out the fire at the source. They reduce substances called prostaglandins, which are involved in inflammation, and that helps reduce pain. NSAIDs are also relatively less likely to cause tolerance. And finally, opioids. This is probably the medication that many Japanese people feel most afraid of. Using the fire example, opioids are like cutting off the wiring of the fire alarm itself. In other words, they strongly block the pain signal. They act directly on receptors and they provide a powerful pain relief. So patients often feel that opioids work really well. But because they work strongly, the body can also get used to them more easily. When pain signals are strongly blocked, the body may adjust and start feeling like it needs more of the medication. So compared with Tylenol or NSAID, opioids are more likely to cause a tolerance in general. Now let's talk about how painkillers are used differently in Japan and Canada. In Canada, Tylenol is very common. It feels like almost every patient has Tylenol ordered as a if needed medication. We call PRN medication. It has relatively few side effects and it's a very standard medication. Of course, if a patient has a significant liver problems, the dose is adjusted. But generally speaking, Tylenol is usually the first option. On the other hand, NSAIDs are something I almost never see, at least on the older adult unit where I work in Vancouver. Especially for older adults, NSAIDs are used very cautiously. The main reasons are that NSAIDs can worsen kidney function, or the patients may already have poor kidney function when they are admitted to hospital. Also, the NSAIDs can increase the risk of bleeding. Those two risks are quite important. In reality, many older adult patients already have reduced kidney function or a higher risk of bleeding. So even though NSAIDs are very common in Japan, in Canada, especially for older adults, they are seen as medications that need to be used carefully. I've been working here for about a year now, and I've already ever seen NSAIDs ordered as a PLN medication on the older adult unit. On the other hand, opioids are used quite often. In Japan, I think many people have the image of opioids as narcotic, scary, addictive, or the last resort. Many people probably associate them with post-operative pain, cancer pain, or end-of-life care. But in Canada, it is quite common to see Tylenol and an opioid ordered together as PLN if needed medications. Of course, the daily dose is carefully controlled by a physician. Patients cannot just use as much as they want in the hospital, of course. That said, it is also true that some people may start to feel like this is the only thing that works for me after using opioids. So if you ask whether the risk of dependence is zero, the answer is no. But doctors are not prescribing opioids casually just because someone says they have pain. They are used properly when stronger pain control is needed, such as for severe pain or cancer pain. So I think the Japanese image of opioids equals scary and addictive. It's not completely wrong, but it's also not completely right. It's somewhere in between. In the end, the most important thing is to use any medication appropriately and for the correct dose, of course. When I first started working in Canada, I honestly felt quite resistant to using opioids. The way opioids are used here felt almost similar to how Tylenol is given in Japan. Of course, Canada is a very multicultural country. People from many different backgrounds live here: India, Middle East, Asia, Europe, South America, and many other places. But from my own experience, I feel that Asian patients tend to be more hesitant about using opioids. Of course, really depends on the person. So, and the people who were born and raised in Canada may also have a more Canadian culture perspective. So I cannot generalize too much. But personally, I do feel maybe that kind of tendency. I also felt that resistance myself when I first started working here. I wondered, is it really okay to use opioids this often? Or could this lead to addiction? Of course, in the hospital, opioids are used according to the prescription at the right timing, with the right interval, and at the right dose. So they are being used safely in that clinical context. Still, I really felt that there is a big cultural differences, right? And NSAIDs have their own side effects, of course, and the disadvantages, and opioids also have both benefits and risks. So in the end, it's important to choose pain medication based on the doctor's judgment and the patient's condition. So today I talked about how the common sense around painkiller use is very different between Japan and Canada. What did you think? Please leave a comment or like the video if you enjoyed it. Thank you for watching. See you next time. Bye bye.